His phone's ringing.
No, don't worry. Good morning, everyone, and welcome to Part 1 of the Apex Benefits Healthcare Reform webinar series. Today's presentation is brought to you by our Healthcare Reform Practice. Speakers include myself, Tracy Gavin, Business Development Consultant and Certified Healthcare Reform Specialist, and John Forrest, also a Certified Healthcare Reform Specialist with Apex Benefits. Just a few housekeeping items. All participants will be in listen-only mode. Questions can be directed online, and we will have time at the end for Q&A. The Supreme Court rendered their decision in June, and the presidential election has passed. Employers must now prepare for our nation's largest transformation in employee benefits. As employers begin taking their first steps, Apex Benefits has established a holistic approach to understand, analyze, determine, and align. Part 1 and 2 of our webinar series will focus on understanding the landscape and requirements under healthcare reform. The third part will focus on analyzing the financial impact, and we will conclude with strategy and recommendations on how to align healthcare reform within your overall business strategy. Today's focus, we will look at employer status under IRS Section 4980H, often referred to as the shared responsibility provisions. We will focus on small and large employer group definition and the impact on each. We will further define large employer groups and the shared responsibility rules and applicable penalties. Secondary, we will look at defining full-time employees. This is one element that recent legislation has come out with much more clarity around how businesses will determine full-time employment status, how they calculate employees on an ongoing basis, and then we will provide comments on how that might impact your overall organization. This will include IRS Safe Harbor rules, definition of variable hour and seasonal employees. We will further go into look-back measurement periods and related stability periods, as well as the administrative period and uniformity. So begin with, under small employer status, small employers are defined as having less than 50 full-time equivalent employees. For small employer groups, the employer mandate and associated penalties do not apply. Proposed regs limit the deductible and out-of-pocket expenses for small groups to an individual of $2,000 in a deductible and $4,000 in out-of-pocket expenses. For fully insured groups for fully insured small groups, community rating will also apply. This will drastically change how insurance companies underwrite small groups. In 2016, community rating will then apply to groups 50 to 100. Some small employers can receive a tax credit if they offer employer-sponsored coverage. And beginning in 2014, small businesses under 50 will have access to what's called the SHOP Exchange, or Small Business Health Options Program, allowing employers the ability to offer employer-sponsored coverage through the public exchange options that will be available. There are additional fees and tax assessments that will apply both to large and small employer groups. In the fully insured market, we will have the health insurer's assessment fees as well as transitional reinsurance fees. The cost of those fees will be dependent on if the group is fully insured or self-funded, but both do apply. And much to the contrary of what some may think, there is still a significant impact to small employer groups under PPACA. Oftentimes, I think some employers will disregard the fact that those under 50 are not required under the employer mandate, and the associated penalties do not apply, but there still will be a significant impact. Specific to community rating, And we will go into this in much more detail during our financial analysis sections. But currently, community rating in 2014, again, will bring significant changes on how insurance companies rate group health plans. Under a pre-reform status, so in today's world, small groups are rated based on demographics, so age and gender, family composition, the geographical area in which the employees reside, whether or not members use tobacco, the group size, the group industry, as well as health underwriting status. So any pertinent health conditions within the group can be used under underwriting. The intent is to match the rate or premium to the overall risk of the group to minimize adverse selection. Community rating beginning in 2014 changes this drastically. So as we all know, pre-existing condition limitations are removed. So the market moves to an adjusted community rating status. So under healthcare reform, all of the elements under the pre-reform status that underwriting currently uses will be consolidated into 5 factors. Underwriters will now be able to rate based on area, so one thing that's similar within pre-reform underwriting. For age status, underwriters can no longer underwrite based on individuals' age other than a 3-to-1 ratio. So meaning, from the youngest to the oldest employee, those rates cannot be different than on a 1-to-3 basis. Rates can also be dictated by family status, so employee only, employee spouse, employee children, and family coverage. And then smoking status can also be used as a health underwriting question, but that is the only health underwriting health factor that can be used. For large employers, the landscape changes quite a bit. Large employers are defined as having 50 or more full-time equivalent employees. These employers could be subject to penalty if coverage is not made available to employees who work an average of 30 hours of service per week. So your current eligibility requirements, for those of you who are large employers, you may have an eligibility requirement of 40 hours or 35 hours. Moving forward, in terms of healthcare reform, employers could potentially face penalty if they do not offer coverage to employees working 30 hours or more per week. To determine who falls into that category, and we will get into much more detail later in the presentation, employers are able to use a look-back measurement period to determine that actual full-time status, so to determine if an hourly employee is in fact working an average of 30 hours per week. Also under healthcare reform, multiple entities under a common control group are treated as a single employer. So if you happen to own, let's say, 3 or 4 gas stations, restaurants, or other entities, but you have a single control group, for purposes of healthcare reform, you are looked at as a single employer. Similar to small group, large health plans are also subject to coverage mandates, reporting requirements, and similar fees and tax assessments as applied to small groups. So to further clarify how to calculate the full-time equivalent status, this will be the only time that employers are forced to look at their part-time population to determine if they in fact fall below that 50 full-time equivalent threshold or above. The calculation can be performed by using the following. So you would accumulate all of your full-time employees having at least 30 hours of service per week or more. You would then add to that number the total hours of service of non-full-time employees, so your part-time employees, and divide that number by 120. So you're assuming that a part-time employee is going to average 120 hours per week to reach that 30-hour per week threshold. So for example, if you were to have 40 full-time employees, so 40 individuals working 30 or more hours, and then you had 20 part-time employees, each working 15 hours per week, the combined total would equal 50, therefore the large employer mandate would apply. when you're to calculate this number, if the total is at least 50 or more, again, the large employer mandate applies, a fractional number can be rounded down. So if you have a fractional number that ends up being 49.7 or 47.9, you do have the ability to round down to reach that small employer group status. There are some exceptions for large groups for seasonal employees. If the workforce has greater than 50 full-time equivalent employees for 120 days or less during the calendar year, and the employees in excess of 50 are employed during that period were seasonal employees for less than 120 days, then the employer is not considered a large employer. So similar to the small group impact, the majority of healthcare reform does impact the large employer groups. So pre-reform, let's talk a little bit about the landscape. If you're currently offering employer-sponsored healthcare coverage, there's no penalty under either circumstance if you offer coverage or if you do not offer coverage. So you have the choice as an employer as to whether or not you provide health insurance to your employees and their family members. You also have the ability to define employee and dependent eligibility. You have the ability to determine how many hours of service per week an employee must have to be eligible for benefits. You also have the ability to determine a waiting period, so a period of time that an employee must work before they become eligible for benefits. Many employers, whether you're fully insured or self-funded, you determine the benefit plan design as a function of the cost of the plan. There are currently some provisions in healthcare reform that are already in place and have put some limitations around that, but historically, as an employer, you've been able to design that plan. You've also been able to regulate employee premiums and the cost share that employees pay for both employee-only and dependent coverage. Under the post-reform environment, it's going to look much different, again, some of which has already come into play, but there are significant changes happening beginning in 2014, which really is causing employers to need to think about that now. Think and prepare how healthcare reform is going to impact them. What measures do they need to put in place, starting as quickly as within the next few weeks in order to prepare for the changes. So under the post-reform landscape, if shared responsibility rules are not met, some employer penalties may apply. The rules for that include minimum essential coverage that is at least 60% in actuarial value. In general, what that means is, on average, an employer-sponsored health plan must pay for 60% of the costs incurred overall by the group, meaning if you were an employee, on average, you would be responsible for 40%. As an employer, you would be responsible for 60%. I think you would all be surprised that many of you may offer at least one benefit option that exceeds that 60% in actuarial value, but that is one of the compliance features of healthcare reform. Under the public exchange that will be available, there are metallic tiered plans that will be made available to individuals and small groups within the public exchange. The 60% actuarial value coverage will be designated as a bronze plan, 70% as a silver, 80% as a gold, and 90% as a platinum plan. In addition to the minimal essential coverage that meets the actuarial value, coverage must be affordable to employees. So premiums cannot exceed 9.5% of household income for employee-only coverage. This was a recent clarification in some legislative updates that came out close to the end of December. Historically, it was undefined whether or not that affordability test would be based on employee-only coverage or would also include dependents. It has now been defined that 9.5% is based on employee-only coverage. Many of you may be thinking, well, how do I know the household income of all my employees? You probably don't. But as a result, new legislation has allowed for one of three safe harbor methods. Those safe harbor methods can be defined as 9.5% of the federal poverty level at 100% in 2014. There's a calculation that you can use a rate of pay, meaning you're calculating it on a monthly basis and what that 9.5% number would be as a function of payroll. Or you can use box 1 of an employee's W-2 earnings to define what that 9.5% number could be. Benefit waiting periods beginning in 2014 cannot exceed 90 days. So some of you may have first of the month following 90 days that will need to be reconsidered as the benefit waiting period cannot exceed 90 calendar days. Also, something that was recently clarified was under healthcare reform, if you were to meet safe harbor provisions to avoid potential penalty, as an employer, you would not only need to meet the affordability and the minimum value test, but you would also have to cover your dependents. Legislation recently defined those dependents as being children, not necessarily covered spouses. So just an overview of the penalties as a result of the shared responsibility rules. The penalties are going to be driven by a few different factors. First and foremost, penalties are assessed based on an individual's qualification for a federal tax subsidy within the exchange, and the penalties are only assessed if that individual receives the subsidy within the exchange. So even though an individual may qualify as an employer, you would only face penalty if that employee received the subsidy. The federal poverty range is broken into 3 different categories. We've all heard that there is a potential for Medicaid to be expanded across the U.S. That is a state decision, and to the best of our knowledge, Indiana has yet to determine whether or not they will expand Medicaid. What that will mean to employers is, for those individuals who earn less than 138% of the federal poverty level, if Medicaid were to be expanded, they would have access to coverage. The next category looks at those who fall 139 to 400% of the federal poverty level. As an employer, this is really the population that you need to focus on the most. These are the individuals that if they earn between 139 and 400% of the federal poverty level, that they could be eligible for subsidy through the exchange. For an employer to eliminate the probability of being penalized, 2 requirements need to be met. First and foremost, employers need to offer that minimum essential coverage based on that 60% actuarial value. Secondly, we talked about the coverage being affordable, so being 9.5%, less than 9.5% of the employee's household earnings or through the use of another safe harbor rule. If those 2 requirements are met, then the employer is not subject to penalty. However, if only one of the criteria is met, meaning you offer coverage, but for those that fall into 139 to 400% of the federal poverty level, maybe some or all of those individuals are being charged more than 9.5% for that coverage. If that's the case, and you currently offer coverage that's unaffordable, the penalty would be $3,000 per individual that not only is eligible for the subsidy, but they have to receive the subsidy. So that's really the key. So employees can be eligible, but the employer is only penalized if the individual receives the tax subsidy. In another scenario, if you offer affordable coverage, but that actuarial value is less than 60%, then similar circumstances apply. Those individuals within that federal poverty range could qualify for a subsidy, and if they receive the subsidy, then it's a $3,000 penalty. Now, if you're an employer, a large employer, and you have greater than 50 employees, and you choose not to offer coverage, or through careful analytical analysis you determine that it's not feasible to continue your health care coverage, you would likely be faced with a $2,000 per full-time person penalty less the first 30 individuals. So the 2,000 and 3,000 are often numbers that we've heard thrown around, but what's important to know is the $2,000 penalty only applies when coverage is not offered and if at least one individual that you do not offer coverage to goes onto the exchange and receives subsidy. The $3,000 penalty would apply if you offer coverage, but it did not meet the two criteria of being affordable and meeting the minimum actuarial value. For those of you that have employees earning over 400% of the federal poverty level, there are no penalties assessed in terms of affordability or minimum value of coverage, but if you do not offer coverage, that $2,000 penalty applies to all full-time employees. Something else to keep in mind that will be important for many employers, if you are a for-profit organization, your current health benefits that you provide your employees are tax deductible. The penalties assessed under healthcare reform are not tax deductible. They are set to be indexed annually, so they will increase, and I suspect that we'll soon find that the $2,000 and $3,000 penalties are far less than what employers would need to pay in order to fund employees having coverage through a public exchange. So with that, I'm going to hand it over to John Forrest. He is now going to focus on full-time employment under PPACA, as well as defining look-back and measurement periods that could apply to a variable hour or seasonal workforce.
Thank you, Tracy. This area of regulations is arguably one of the most complex. As an example, last August, the IRS issued 18 pages of regulatory guidance just to answer the question, what is a full-time employee? So in our allotted time, obviously, what we'll try to do is at least identify all the moving parts. First, a full-time employee under PPACA is a common law employee averaging at least 30 hours service per week or 130 hours per month. And when we say common law, we're talking about for 4980H purposes or general tax purposes definition, so that is narrower than the broader term of employee under employment law. Individuals who are not common law employees are disregarded, such as leased employees, partners, sole proprietors, more than 2% shareholders in sub-chapter S corps, and bona fide independent contractors, or those that we call 1099. Employers may disregard hours worked overseas or hours an employee does not receive U.S. source income. Now, for most employers, obviously, it's easy to ascertain who the full-timers are. They generally hire people 40 hours a week. It's generally for, hopefully, an indefinite period. But there's a category of employers where this is actually very complicated. For example, restaurants and staffing organizations. So with that, we have a few definitions. First, the variable hour employee. This means based on facts and circumstances on the date of hire, it cannot be determined that the employee is reasonably expected to provide an average of 30 hours per week service, or if the employment at more than 30 hours per week is reasonably expected to be of limited duration. So the first part of that equation, obviously a restaurant might hire someone that would work 15 hours one week, 32 the next, 36, then back down to 20. The second part of the equation, probably more applicable to a staffing firm who knows when they hire someone, they could be 30 or 40 hours, but they honestly don't have control or know how long that employment could last. Now, a caveat. The IRS has said as of 2015, that goes away, the limited duration. They will defer enforcement of it during 2014. In other words, if you hire a variable hour employee you can no longer assume that the duration will be limited. The IRS is saying you have to make the assumption that employment will be indefinite unless it occurs otherwise. A seasonal employee. This isn't really defined. The employer is expected to use a, quote, reasonable good faith interpretation, end quote, until further guidance. But as it's applicable to the safe harbor that we're going to discuss, apply the same measurement and stability periods. The IRS Safe Harbor look-back, as it's called, method. This is allowing time to determine the full-time status for the certain types of employees we just mentioned for the purposes of the shared responsibility requirements. So, you may look back a period for counting hours to determine if the variable hour or seasonal employees are full-time. Additional rules apply to employees terminated or rehired or those under extended absence under FMLA, for example. Just one example of that is if the employee is not having any hours of service for 26 consecutive weeks and the employer rehires them, they, under that situation, could allow that the employee was terminated and then treat the employee as a new hire. If it's less than 26 weeks, just for purposes of shared responsibility, and the employee is hired back, they have to be considered an ongoing employee. There are other rules around this we don't have time to get into, but it can be complicated. Interim guidance is good through 2014. The measurement and stability periods. Now, the measurement period, the employer can select a standard look-back period in which to count these hours, any period between 3 months to 12 months, to determine if the employee is full-time, again, 30 hours per week average. The stability period, that's the period if the employee meets the full-time threshold, they must be treated as full-time during this entire period, regardless of the hours that they work, so long as they're employed. The employee must be offered the coverage. This standard stability period may not be shorter than the measurement period, and it may never be shorter than 6 months. And conversely, if the employee doesn't meet the threshold for full-time employment, the employer can treat that employee as if they are part-time or haven't met the threshold during the stability period regardless. The measurement period, the employer selects the look-back period again. The measurement period, the employer selects the look-back of 3 to 12 months to determine if the employee is full-time. Again, the stability, the period, the employee must meet the full-time threshold, and then they're treated as full-time. The initial measurement period, if you hire someone new and their variable hour, the initial measurement period begins on their day to hire. Now, the IRS has allowed that rather than force an employer to have 260 different measurement periods, which would be work days in a year, the employer may choose the first of the month as a hire date. And recent regulatory proposed regulations that came out last month would allow the employer to split that period so that it's consistent with their payroll periods of 1 week, 2 week, or semi-monthly. Now, the maximum combined look-back and administrative period for new hires is 13 months plus a fraction of a month. And so therefore, the combined periods must end by the last day of the calendar month, starting after the first anniversary of the employee's start date. Those are two extremely complicated sentences, but just here's the takeaway. If you were to hire someone in the middle of a month and started their measurement period the first of the month, that's the fraction of a month. then the 12 months where you're actually counting hours. So now you have 12 plus the fraction. And then the IRS would allow another 30 days of administration time where you could process the employee's enrollment if they qualify. We could provide, if you ask us, a chart of that, but basically if I were to hire someone on December 15th of 2013, start their measurement period on January 1st, I would be counting hours during the calendar year of 2014. I've got 30 days to process that. If the employee meets the threshold, then their coverage would start February 1st of 2015. This chart shows us the parameters that the IRS has laid out for the measurement and its associated stability periods. If we look in the left-hand column, again, we see the measurement period can be as short as 3 months or as long as 12 months. However, over in the right-hand column, we see again the stability period may never be shorter than 6 months and never shorter than the measurement period. There is an exception. If a new hire doesn't meet full-time status during the initial measurement period when you're counting the hours, they may not have a stability period that follows that is longer than 1 month than the measurement period. The administration period, this is an optional period of time, and it's between the measurement and stability coverage period. It may never exceed 90 days, and again, it allows time for the employers to notify employees that qualified for coverage and to get their enrollment processed. The IRS also has employers strictly go by what we call uniformity. These chosen periods of measurement stability have to be consistent for all employees. However, there's a little bit of leeway. The employer can vary the length of those periods between certain classifications, such as salary versus hourly, collective bargain agreement versus non-collective, different entities, which frankly isn't very well defined yet, and employees that are located in different states. Here's a quick example of a 12-month measurement. The employer selects their standard measurement period. Again, they have a choice between 3 and 12 months. If they chose 12 months, it could be the calendar year or any other 12 consecutive months of their choice. So during that period, the question that the employer is seeking to answer is, did the employee average 30 hours per week service over the time period? And just to see the equation visually, 130 hours average times 12 months, the threshold would be 1,560 hours. We would like to note that the IRS is allowing for 2013 only. Employers that are intending to use the 12-month maximum measurement period in 2014 and in subsequent years, they can use a transition measurement period of less than 12 months. Here are the rules. It has to be at least 6 months long. It can begin no later than July 1st of 2013, and it can end no earlier than 90 days prior to the first day of their 2014 plan year. Now really that wraps up the overview that we present here in Webinar 1 in our series of 4. And right now I'd like to turn it back over to Apex Benefits Healthcare Reform Practice Leader, Tracy Gavin.
Thanks, Sean. So just a few final thoughts today. This is the first series or first webinar in a 4 to 5 part series. I would like to encourage everyone who participated today to look at the additional webinar series options that are available. While that we do consider them standalone, as you can imagine, topics covered in each webinar are very different, and will build on one another. So just again, a few final thoughts and takeaways for today. As many of you are faced with, decisions, changes, all of the legislation, all of the information that you hear on the news, read in the newspapers, changes upon us, and it does require immediate action. That immediate action applies to many different things within healthcare reform, and it will change dependent upon your employer size, the number of employees, your type of employment. Do you have hourly versus salaried employees? John's focus today was really on that variable hour workforce. Preparation for 2014 and beyond demands the need to understand the financial costs, administrative burden, and impact to employees. The financial cost to an organization that we will cover and the third part of our series, we're finding to be significant for all size employers. Earlier today we talked about the underwriting community rating that applies to small groups and then will apply to those under 100 in 2016. Those numbers are going to continue to go up. The preliminary costs that we're seeing in terms of estimates for cost of coverage through the exchange is pretty shocking. Part 2 of our webinar series will cover exchange options, Medicaid expansion, and subsidies. So we will further define what it's going to look like for your employees, what type of exchange options might be available within the state of Indiana or if you have populations in other states. That webinar is set for February 13th at 9:30. If you have not registered yet, you can do so on our website. One of the questions that we received today, I'll just throw that out there since it kind of follows suit with final thoughts. If you have a plan that is a non-calendar year plan, so it's a fiscal plan, transitional rules are available, or transitional rules do apply. The recent legislation that came out last month does define when and how fiscal year plans will need to comply with healthcare reform. So again, just a lot of moving parts, a lot of different aspects that need to be reviewed, whether it's eligibility under the plan, financial implications, compliance, documentation, developing a strategy to minimize your risk and to maximize the opportunity you have as an organization to position healthcare reform and all of its changes to create a positive impact for your organization and your employees. Certainly, regulatory uncertainties out there, the treatment of wellness discounts. In 2014, wellness discounts are set to increase to 30%. What's undetermined is if you can use the affordability, when you use the affordability test, if you can base the affordability test on wellness discounted premiums or non-wellness discounted premiums. Some of you may have heard about non-discrimination testing. While it's currently not being enforced and still under legislative review and definition, non-discrimination testing will apply sometime in the future. And that's important for organizations to understand if they have different waiting periods for different classes of employees, if they have benefits that are offered to some but not all employees, if those benefits are favored more towards highly comped versus those who have lower wages. The implementation schedule for healthcare reform, preparation in the near-term future is critical, despite not having everything in place. The next piece of compliance is looking into March of 2013, where employers are required to notify employees of the exchange options that will be made available to them. We've been told that the notices for this will be similar to federal notices around HIPAA, COBRA, and other types of compliance. I have yet to see a draft, so just know that that's something that you're going to need to take action on within the next 60 days, but we haven't seen anything to provide guidance yet. And lastly, employee communication. Even greater need to help your employees understand the value of your employee benefits programs, understand what the individual mandate means to them, For the most part, all individuals will need to obtain health care coverage. And if they choose not to, they could be faced with tax penalty. And then employees need to understand what their benefit options are. As an employer, you have a choice whether or not to offer benefits, but truly understanding how that will impact your employees. You know, what are the costs to them in the exchange compared to the subsidies they may or may not be receiving. So we thank you all for attending. We do have a couple of questions. I'm going to kick it back over to John to announce the questions, and we will further discuss.
Someone has asked if we'll have access to these slides. The answer is yes, and we will send those out to everyone who's logged in.
So a copy of the presentation will be emailed to everyone this afternoon.
We have a question on clarification around affordability and the associated penalties. If an employer offers an affordable employee-only coverage under the 9.5%, I'm assuming of their W-2, but an employee plus dependent coverage is not affordable, will the employee be assessed penalties? Well, if the employee has passed the affordability test, they're not paying more than 9.5% of, for example, their W-2 for single coverage, and someone else in the family goes to the exchange and qualifies for the subsidy, there would not be an associated penalty.
So in short, if you offer employee-only coverage and those employees pay less than 9.5% of their household earnings for those coverage, you are not required to subsidize coverage for dependents. There is a requirement to offer and make available coverage, more specifically to those with children. But if you were to basically cover the majority of the cost for employee-only coverage, you are not forced or impose penalties for not subsidizing dependent coverage.
I believe that's it, Tracy. Thank you.
So that wraps it up for today. Again, thank you all for participating. If you do have additional questions, our contact information is listed on the last page and will also be included within the presentation that will be emailed this afternoon. Thank you, everyone.